More than 70% of patient files at the Johannesburg clinics reportedly belong to foreign nationals, and that's according to Action SA's parliamentary leader Ethel Trollip. The claim comes as the party tables a series of proposed constitutional amendments aimed at addressing what it describes as South Africa's growing immigration challenges. Action SA argues that the country's generosity and limited public resources are being stretched to the limit. To discuss the party's proposal further, I'm now joined by Action SA parliamentary leader Ethel Trollip. Ethel, a very good morning to you. Thank you so much for making time for us this morning. What's at the core of the proposals that Action SA is making here with regards to the constitutional amendments?
Good morning, Eldrin, and good morning to the viewers. Firstly, annually there's a call for people to make constitutional amendment submissions to the Parliamentary Review Committee. We have done that, and this particular submission deals primarily with our preamble of the Constitution, where it says South Africa belongs to all who live in it. We aim through our submission to address the persistent misrepresentation of this clause. And the example that you gave is a perfect example. South Africa belongs to all of its citizens and all permanent residents and all legal immigrants. But it doesn't belong to people who are here illegally. And some of the generosity expressed in that preamble of our Constitution to say it belongs to all who live in it are expressed in the Bill of Rights. And in the Bill of Rights, for example, there are three areas that we raise in our submission. Firstly, the right to housing, or if you're removed from where you live, the right to emergency temporary accommodation. That is a right given to all South Africans in the Bill of Rights, stemming from the preamble. The other one is the right to education, and we've seen that our schools are full, and South African citizens are battling to get their kids into school because the Constitution makes provision for immigrants, legal and illegal, to send their children to the nearest school. And also in the case of healthcare that you mentioned now, where our healthcare facilities are overrun, taking care of the needs of illegal immigrants. Now, we don't want to turn our back on anyone in this country, and we really admire the noble intentions of the preamble that says South Africa belongs to all who live in it. But charity really begins at home. And we want the Constitutional Review Committee to relook at these intentions of the preamble and those three particular areas of the Bill of Rights to make sure that South Africans get into the front of the queue and not the back of the queue.